I'm Dr. David King. I'm a musculoskeletal oncologist here at Froedtert in the Medical College. I'm originally from Iowa, where I grew up and went to medical school. Following medical school, I decided to do an orthopedic surgery residency. I trained at the University of Chicago for 5 years and then had a decision on what to subspecialize in. I chose musculoskeletal oncology, which is the care of benign or malignant tumors or abnormal growths of the arms, legs, pelvis, and trunk. I chose musculoskeletal oncology for a number of reasons. First and foremost, I wanted to make a significant difference in patients' lives. I wanted to be able to take a scary, potentially worrisome situation and make the best out of it for patients and their families. I thought I could make a significant impact in that way. I also enjoy the fact that I'm able to take care of patients all the way from childhood to adulthood, and I also find the challenge of operating on different areas of the body and having unique situations with every tumor and every patient challenging and rewarding. As a musculoskeletal oncologist, I spent the majority of my fellowship learning how to salvage and save limbs. When patients are diagnosed for the first time with a tumor of their extremity, one of the first questions that comes to mind is, am I going to be able to keep my arm or my leg? That's something that we focus on. We've had excellent limb salvage outcomes here at Froedtert Medical College with over 98% limb salvage rates over the last 10 years. There are numerous options to reconstruct an extremity. The first thing that we do is we want to make sure that we remove enough tissue to keep the tumor from coming back, but preserve as much of the normal tissue as we can. That's critical and requires advanced imaging and advanced surgical techniques. Following removal of the tumor, then we have numerous options. If it's a soft tissue tumor, we'll often take tissue from the patient and rotate it, or take tissue from another spot and fill in that defect to try and get the best outcome. If it's a bone tumor, we'll remove the bone and then reconstruct it and recreate the bone with numerous techniques. One of the techniques we can use is from tissue from cadavers, where we use donor bone, and that can provide excellent outcomes. Another option is to use metal implants, which end up being kind of fancy hip or knee replacements or shoulder replacements. We at the Medical College and at Froedtert are able to utilize the most advanced techniques that are out there, including limb lengthening techniques that are done non-invasively. Our goal is always to individualize the reconstruction for the individual patient and to provide the best function that we can and the longest lasting implant or reconstruction that we can offer to minimize future problems for patients. Patient recovery following limb reconstruction is as individualized and varied as the reconstruction options and the tumors that they present with. Our goal is to first and foremost get the wounds to heal, and then recovery usually involves an extended period of physical therapy, and that's when the patient really has to step forward and maximize their outcomes by participating with us as surgeons in their recovery process. I feel very fortunate to work at Froedtert in the Medical College. This is where I came following my fellowship, and I've been here for over 10 years now, working with a fantastic team of multidisciplinary experts. I am always confident that every patient is getting the optimal care that they possibly can, from diagnosis and biopsy through various treatment options to their recovery and their rehabilitation. Working at Froedtert provides me an opportunity to teach. I teach medical students and residents. We are actively involved in many research endeavors to try and improve the care of our existing patients, as well as to hopefully improve the lives of patients for years to come.